Okay, so you're ready to dive into some really interesting research with us.
Absolutely.
Perfect.
Let's do it.
Today, we're going to be talking about hyperkalemia treatment. And, this is something that I think a lot of people listening have at least heard of. Maybe they don't know all the ins and outs. But we're going to try to really, like you said, dive deep into this new research. And specifically, we're going to be looking at a 2024 article from the Nephrology, Dialysis, and Transplantation Journal.
Okay.
And we're really interested in kind of highlighting what's new, what's changed, and how we should be thinking about treating high potassium. Because one of the things that I found really interesting is how much this research challenges some of the old ways of thinking about this condition.
Yeah, for sure. It's really interesting to see how our understanding of this condition and how to manage it is evolving.
Mhm.
We often fall into these patterns in medicine of like a one-size-fits-all approach. And this research really highlights, the need for a more personalized approach, especially when we're talking about chronic hyperkalemia, which is, the kind of slower, gradual increase in potassium levels.
Right. So before we get into like the long game of managing this, let's talk about when it becomes a real emergency,
Mhm.
like when you have acute hyperkalemia.
Yeah, so acute hyperkalemia, I mean, that's like a burst pipe.
Oh, okay.
You've got to take immediate action to fix it. Because if you don't, it can lead to some serious problems, especially with the heart.
Yeah. And the research really emphasizes that, like how quickly it can become dangerous.
Oh, absolutely. And that's why they outline this really clear three-step approach for these really urgent situations. So the first thing, stabilize.
Okay.
And that often involves giving 5E calcium. Now, what's interesting about calcium is it's not actually lowering the potassium level right away.
Mm.
It's more like it's protecting the heart from the dangerous effects of that high potassium.
So it's like a shield.
Exactly. It's buying you time for the other interventions to kick in.
Okay, that makes sense.
Yeah,
So we're not trying to solve the whole problem immediately, but we're giving the body a chance to catch up,
exactly. And that leads us to that second step, which is all about shifting the potassium.
shifting it.
Yeah, so we're trying to move it from the bloodstream into the cells where it's not as dangerous for the heart. And we do this using a tool that you might find surprising, insulin.
Insulin? Like for diabetes?
Yep, that's right.
Wow.
It might seem counterintuitive, but insulin is actually really effective at driving potassium into cells.
I had no idea.
Of course, we have to be really careful about blood sugar levels when we use it.
Right, of course.
So we always give dextrose along with it. And just as a side note, albuterol, which is that medication in asthma inhalers, it can actually have a similar effect on potassium.
Oh, wow. See, this is what I love about these deep dives. You start to see these connections between different areas of medicine that you wouldn't expect.
It's fascinating, isn't it?
But even with the insulin and the albuterol, we're not actually getting rid of the extra potassium, right?
That's right. That's where step 3 comes in elimination.
Okay, so how do we actually get it out of the body?
So there are a few ways to do this. We can use medications like diuretics to help the kidneys flush it out.
Okay.
There are also medications called potassium binders that actually trap potassium in the gut.
Oh, interesting.
And then in very serious situations, you might need to use dialysis, which directly removes potassium from the bloodstream.
And that's really effective, right?
Oh, absolutely. Dialysis can be truly life-saving in these acute situations.
I remember reading in this research about how quickly dialysis can lower potassium levels. It was something like a 1 LEQL drop in the first hour.
Yeah, it's pretty remarkable. But when we start talking about chronic hyperkalemia, that's when this research really challenges some of our old ways of thinking.
Yeah, and that's what I'm really interested in digging into today. So let's shift gears a bit and talk about the long-term management of this condition. Because one of the most surprising things I took away from this research is that maybe we've been too restrictive with potassium for all CKD patients.
Right. That's a big one.
Can you talk a little bit more about that?
Yeah, so for a long time, the standard of care for managing potassium in patients with chronic kidney disease has been to put them on these really strict dietary restrictions. But this research is really questioning that and suggesting that we may need a more nuanced approach.
Okay, so rather than just telling everyone with CKD to avoid all potassium-rich foods, what are some of the alternative strategies that this research suggests?
Well, I think the first thing is to remember that not every CKD patient is at the same risk for hyperkalemia.
Well, that's a good point.
It's really when their kidney function gets to a certain level that it becomes a big concern.
So it's not necessarily about overreacting.
Exactly. It's about assessing their risk individually and then tailoring our approach based on that.
That makes a lot of sense. So it's all about personalized medicine, really.
Absolutely.
So besides taking a more individualized approach to assessing risk, what are some of the other things that this research highlights? What are some of the other things that this research highlights?
Well, another important factor is medication review.
Oh, really?
Mm.
A lot of people don't realize how much medications can affect potassium levels.
It's true. And there are a lot of common medications that can actually worsen hyperkalemia.
Like, what are some examples?
Well, one example is NSAIDs, so those over-the-counter pain relievers like ibuprofen or naproxen.
Oh, wow.
Yeah, a lot of people take those regularly, and they can really impact potassium levels, especially for someone whose kidneys aren't functioning optimally.
So it's not just prescription medications we have to
Yeah,
be careful with.
exactly. Even some herbal remedies can have surprisingly high potassium content.
Oh, really? Now you got me curious.
Well, one that comes to mind is noni juice.
Noni juice.
Yeah, it's become pretty popular as a health supplement, but people don't always realize just how much potassium is in it.
See, that's something you'd never think about.
Right.
You see a juice and you think, oh, it's healthy.
Exactly.
But it's really important to be mindful of these hidden sources of potassium.
Absolutely.
So we've talked about individualized risk assessment, and we've talked about medication review. But what about diet? I mean, we touched on how restricting potassium for all CKD patients might not be the best approach. But what does this research say about what people should actually be eating?
So it's not really about eliminating all potassium-rich foods. It's more about making smarter choices about the types of potassium we're getting.
Okay, so tell me more about these smart choices.
Well, one key point is that not all potassium is absorbed by our bodies in the same way.
Oh, that's interesting.
Yeah, so the potassium that's naturally found in fruits, vegetables, whole grains, it's actually less bioavailable than the potassium that's added to processed foods and drinks.
So like eating a banana is different from having a sports drink.
Exactly. Even if they have the same amount of potassium listed on the label, your body's not going to absorb it all the same way.
Because of how it's bound in the food.
Exactly. And the potassium in those whole unprocessed foods, it's often bound to fiber, which actually helps your body get rid of excess potassium.
Oh, wow. So it's like a double whammy. You're getting less of the absorbable potassium, and then the fiber is helping to get rid of what you don't need.
Exactly.
So it's not about fearing potassium-rich foods. It's just about being mindful of the source and choosing wisely.
I think that's a great way to put it.
And then in addition to diet, are there other things that can help manage potassium levels long term?
Yeah, definitely. So making sure any other treatments are optimized is really important.
Like what?
Well, if someone's on diuretics, for example, we want to make sure those are working effectively to help flush out excess potassium.
Okay, that makes sense.
And then addressing any other underlying conditions that might contribute to hyperkalemia, like, for instance, acidosis.
Right.
So it's really about looking at the whole picture.
Now, this all makes sense, but I have to ask, what about medications like RAAS inhibitors? I mean, those are often crucial for people with kidney problems, but they can also increase potassium. So it seems like we're stuck between a rock and a hard place.
It's a common dilemma that we see.
Right.
RAS inhibitors, they're so important for protecting the heart and kidneys, especially in people with CKD. But they can definitely lead to higher potassium levels.
So what do we do?
Well, for a long time, it was a balancing act, trying to manage that risk without stopping the medication altogether. But this is where the research gets really exciting.
Okay, tell me more.
There are a couple of newer approaches that are showing real promise for allowing patients to keep taking their RAAS inhibitors safely.
Okay, now we're talking.
One really promising development is the emergence of potassium binders.
Potassium binders?
Yeah.
What are those?
So these medications work by actually binding to potassium in the gut,
Oh, interesting.
which prevents it from being absorbed into the bloodstream.
So they're like little potassium magnets?
It's-
They just grab it and escort it right out of the body.
That's a great way to think about it.
That's really incredible. And the studies are showing that they're effective.
They are. They've really been a game changer for a lot of patients.
That's amazing. Now, you mentioned there was another promising approach.
Oh, right. The other one involves a class of drugs called SGLT2 inhibitors.
SGLT2 inhibitors. Now, those are typically used for diabetes, aren't they?
They are, but what's fascinating is that they're showing a lot of promise for reducing hyperkalemia risk, specifically in people who are taking RAAS inhibitors.
That's like a bonus benefit.
Exactly. And what's even more interesting is that while they do have a small effect on potassium in people with healthy kidneys, their effect seems to be amplified in those with reduced kidney function, who are also on RAAS inhibitors.
Oh, wow. So they're really targeted in their action. That's incredible. This research really changes how we think about managing potassium, especially in the context of CKD. It's like we've gone from this kind of one-size-fits-all approach to potassium. to this whole new world of personalized medicine.
It really is
And I
remarkable
love how this research highlights those connections, between our diet, our medications, even other health
how it's
conditions.
all connected.
And speaking of connections, I know some of our listeners are probably wondering, what are the names of those potassium binders you mentioned? Just so they can jot them down and do some more research.
Oh, absolutely. The two most commonly used ones are patiromer and sodium zirconium cyclosilicate.
Okay, so we've got paramer and sodium zirconium cyclosilicate.
That's right.
Got it. Now, before we wrap up today, I want to circle back to something you said earlier about how this research is challenging some really deep-seated practices in medicine.
Yeah, it really is.
For you, what's the biggest takeaway here?
I think the most important thing this research highlights is the need to constantly be challenging our assumptions. For years, we approached potassium management in a pretty specific way, especially for patients with CKD. But what this research shows is that a one-size-fits-all approach isn't always the best.
Right.
It's about personalized medicine. It's about really careful assessment. And it's about having these open conversations with our patients.
It's about empowering patients to be a part of the decision-making process,
Exact.
to be active participants in their own health.
Absolutely.
Well, this has been a fascinating deep dive. Thank you so much for walking us through all of this groundbreaking research.
It's been my pleasure.
And for our listeners out there, if you want to learn more about anything we talked about today, we'll have links to all of the research and resources mentioned in the show notes, so be sure to check those out. And until next time, stay curious, and we'll catch you on the next deep dive.